Welcome to the PCOS Fertility Health Podcast, where you will learn how to boost your chances of getting pregnant. You are in the right place if you have PCOS and you are struggling to get pregnant. You are tired of getting dismissive information like, just eat better and stay on birth control, and you want fertility answers. Join me, your host, Dr. Angela Potter, to learn key steps to optimize fertility with PCOS. I am the creator of the PCOS Fertility Protocol and have also shared the stage with leaders from companies like Microsoft and Google. So get ready for another powerful episode about boosting fertility with PCOS. Let's dive in. All right, welcome to today's episode. We are diving into the number one most common mistake that women are making when it comes to PCOS fertility. And I think you're just really ready to hear this mistake because you don't want to be doing it, right? You want to know, okay, am I doing it? And how can I move around this? Or how can I avoid this if I'm not doing it yet? So I'm going to share that with you in a minute. But as we get started, let's talk about cars and how they are connected with fertility. Have you ever seen a car being built? It's a fascinating process. And cars are built in factories, right? And they used to be built with people, putting on all the different parts as they're moved forward on this conveyor belt. And now, I think for the most part, it's robots. Robots are being used a lot. And this car, or basically the metal, is started out and then it gets stamped so that creates the body of the car. And then it just gets the robots keep adding parts to it to, make it into the safe, cool car that you want to be driving around. And it's all based on programming, right? Even when humans were building the cars, there was an algorithm to what part needed to be next on the car, right? And with the robots, they are programmed so that when one action is completed, then the robot knows exactly what next one to be done. Or its robot friend says, oh, my robot next to me just put on the steering wheel, so now I need the axle or something. I don't build cars. But basically there's this blueprint, and that is then transcribed basically onto this conveyor belt. And that car is built in a very dialed in, specific way, and there is no moving from that algorithm, that conveyor belt, right? The moment that steering wheel is put on, the exact next moment, it is being connected to the axle or the wheels or whatever it needs to be connected to, okay? And there's no budging. And it goes through that process until it comes out as the car that you want to be driving around. So right now, with fertility care, it's really similar to a conveyor belt, okay? So you go into a fertility clinic and they ask you a couple questions about how long you've been trying to get pregnant, how old you are, and what kind of tests you've had done, your family history, things like that. And then doctors, they have an algorithm to move forward with how to support your care for fertility, okay? I'm really familiar with these algorithms because, well, I'm, required to stay up to date on these therapies and treatment plans, of course. But it's fascinating to me because I know that there is so much more than what's available in this algorithm. And so basically what the algorithm is, what the conveyor belt is for fertility care is number one, the number one really is diet and lifestyle, which often gets translated very poorly from doctors to their patients. And how I know this is just from talking to so many women with PCOS who will come in and tell me, oh, well, my doctor said, everything will happen once I lose 150 pounds. Or, just eat 500 calories a day and lose all that weight, and then everything will happen. Or, get back on birth control and just remember to eat better. And this is really dismissive information, even though the doctor is probably coming from a really, they want to be helpful, but it's just dismissive and it's not helpful. And then it leaves you feeling like it's your body that's doing something wrong. And, why can't you just lose 150 pounds? It's not your fault, okay? It's not your fault. And you should be getting care that actually supports your body to lose weight. But that's getting off of track a little bit. So, okay, so the algorithm first is like lifestyle changes, and then the second is letrozole, and then the third is IVF. So if you go in and talk to your doctor, they might tell you, okay, try, to eat better and lose weight. If that doesn't happen, then they put you on letrozole. If that doesn't happen, well, they can put you on letrozole for a few cycles. And then if you're still not pregnant, then the only option they have is to move you forward to IVF. And so do you see how this is similar? Like it's just this straightforward path. There's no deviating from that path. So, the moment that letrozole doesn't work, they are recommending IVF to you. Okay. Because that's the only path that they are familiar with and that they can put you down, right? Because it's in the literature for how to move forward with PCOS. Side note here, it is also well documented in these, medical resources that PCOS is something that is still very much needs to be researched to fully understand what's going on with fertility and PCOS. So the medical community is very open about saying, hey, we're not sure exactly what's going to open up fertility with PCOS, but here's what we know so far. Okay. So you're being moved forward on this fertility conveyor belt. And why this is not helpful for fertility is because PCOS is, I'm going to call it a complex syndrome. And this isn't to feel down, so, stick with me here. But PCOS is a syndrome, which means different symptoms lead to the diagnosis of PCOS. And those different symptoms can look different in everyone, right? So your symptoms, well, basically, I encourage you to go listen to my episode about the diagnosis of PCOS, which I will link in the show comments here. But basically, there's 2 out of 3 criteria that you need in order to be diagnosed with PCOS. So your 2 things making up your PCOS might be different from your sisters, and those might be different from your neighbors and all this. And so your PCOS, what's making up your PCOS is really unique. Okay. So do you see how, all right, well, I've got this unique PCOS going on in my body. How does that translate to a conveyor belt type of fertility approach? It's very difficult, right? And so another way to describe this conveyor belt type of fertility is a one-size-fits-all approach or a cookie cutter approach. And PCOS does not respond well to this type of approach. There is no magic pill for fertility, right? We know that because if there was, everyone who wanted to get pregnant could get pregnant, right? And that's just not happening right now. And there are some really big missing pieces to the fertility journey, which is why I'm so happy that you're here listening to this podcast because you're going to figure these out. Okay, so the number one mistake that women make with fertility is to continue on this conveyor belt of fertility and not get an individualized plan. Okay, so let's break this down. The conveyor belt of fertility is moving forward with the fertility medications, basically letrozole and then IVF. Sometimes metformin is used, sometimes Clomid is used. Now, I also want to be clear here that fertility medications are not the problem, okay? They are helpful for so many women who are trying to get pregnant. So I am not standing here telling you that fertility medications are bad or they shouldn't be used. Not at all, okay? The issue is that fertility medications are being used at the wrong time during the fertility process. Okay. So right now in this conveyor belt type of fertility care, the medications are being used as the shining light of what is going to open up fertility. And, if you go in and talk with your doctor about wanting to get pregnant and you've been trying for X amount of months and it hasn't happened, and they jump you straight to trying rounds of letrozole without first really understanding your body, your health picture, and how all of the things inside of you are contributing to your fertility, contributing to your ovulation being low. Do you see how that keeps your chances of getting pregnant low? Yeah. And so what needs to happen is first working with a clinic or a provider, a doctor who's going to help you with that individualized plan. And that plan is going to then set you up to be focused on exactly what's going on in your body that's keeping you from ovulating, that's keeping you from having a baby, and getting those parts optimized. And then do you see, sometimes natural fertility will just open up, but do you see how then that also sets you up that if you do need letrozole after that, how that increases your chances of letrozole working? Or perhaps you need to go to IVF. Do you see how that improves chances of IVF working? So let's dive into this individualized plan. Like, what does this exactly look like? So you want to be asking yourself, if you are working with a fertility doctor or a fertility clinic right now, are they doing these things for me? And if not, you want to keep searching. Okay. So an individualized plan should include a nutrition plan that helps you figure out what types of foods that you should be eating, that supports your PCOS and helps open up fertility. And is not just that dismissive information like, okay, go eat 500 calories a day and lose 100 pounds, and then your fertility is going to open up. No, it needs to be a sustainable eating plan that is nourishing and bringing in fertility enhancing nutrients and eating foods in a way that support fertility that's easy for you to implement. Okay. Meal plans are a great idea. That's something that I give out to my clients and patients, meal plans, so that they can put that into action in their day-to-day lives. Okay. So you want an individualized plan that helps improve your egg quality. Egg quality is a missing link to so much of fertility care. And you bet we are going to be talking about egg quality on this podcast. But you want to know that your provider is talking with you about the importance of egg quality and getting you on a plan that helps improve egg quality. Okay. This is particularly important for you, even if you aren't trying for a natural pregnancy. If you want to go straight to letrozole, or you're already putting eggs aside for IVF, egg quality needs to be at the highest focus of your fertility plan. Okay. Okay, so then you also want an individualized plan that looks at this complete nutrient levels in your body, as much as we can, test for right now. But nutrients are really important to help enhance fertility. A classic example is vitamin D. If you haven't had your levels of vitamin D tested, then getting them tested is really important, because researchers out there have found that lower levels of vitamin D are correlated with lower levels of fertility. And when vitamin D stores get optimized, then that increases fertility chances. So do you see how if nobody has helped you with your vitamin D or helped you test for it and optimize your levels, but yet they're just offering letrozole, do you see how your chances are still low of getting pregnant if you don't have optimal vitamin D and they're just saying, well, the one thing I can give you is letrozole, right? Big missing link with the vitamin D there. And that's just one piece, okay? Because you want to see different nutrient levels in the body, nutrients, okay? And then you also want to be looking at hormone imbalances. Well, are your hormones in optimal levels? And what's out of balance? What needs to happen? Because hormones are a whole system in of themselves, right? It's the endocrine system. And so they're talking to each other. And if your doctor is only testing your main, and I'm putting these in air quotes for those of you who aren't listening, main reproductive hormones like estrogen and progesterone, and not testing for other hormones, that's another huge missing link for you that you do not want to be missing out on to keep you from getting pregnant, okay? So you want a comprehensive look at what your hormones are doing. Hopefully your doctor is testing testosterone for you because that's a part of the fertility PCOS diagnosis. Sometimes we can say, oh, this person has elevated testosterone if they have, acne and lots of extra hair growth growing on the body. But then you want to know how much your actual testosterone and androgen hormones are. So then you can have a plan to help lower those. And then you can see how those are coming down as you then retest a few months after your treatment. Okay. Thyroid hormone is another classic hormone that is mistaken, I'll say, in the fertility world because most doctors are only checking for the main thyroid hormone, which is called TSH. You might be familiar with that. That is the hormone that comes from your brain and talks to your thyroid. There are then hormones that go from your thyroid all to the rest of your body. They go down to your ovaries, to your brain, all over your body to help your body function. And often those aren't being looked at. And so, are you getting a comprehensive look at your hormones? And then also, is your doctor interpreting them from a fertility standpoint rather than from just the standard reference ranges? And I've got on my list of next few episodes is to talk about labs. So stay tuned for that episode where I'll just dive even more into this. Okay. But with this individualized plan, you also want your doctor to be helping you in this wider picture of your health. Are they asking you about your gut health and seeing if there's any connection between gut issues and your fertility? Are they talking to you about the importance of lowering toxin exposures and the connection between being exposed to these endocrine disruptors that are then causing ovulation issues and your hormones to not be in the right levels that they need to be for fertility, right? Are you having these conversations? Are they providing you helping you, with a plan for these and helping you figure out, is this something that is a part of your fertility journey? Okay. Um, you also want in an individualized plan is this doctor to be helping you investigate different reasons why you aren't getting pregnant. So, looking if they have you on a plan and then things aren't happening yet, then they are continuing to talk about different testing or different ways to understand what the body is doing and why it's keeping you from getting pregnant. And so you just want to be working with a doctor who really is invested in your health and can help you investigate and really just do this deep dive into figuring out how to best open up your fertility. So doesn't that feel really good to think, wow, if someone was investing in this way, in these ways in my fertility health, like how that can open things up for me? It's really exciting. And again, like this could open up natural fertility, but if it doesn't, then it just increases chances of those medications. I just want you to know that if you have talked with a doctor or you're working with a doctor who has given you this type of dismissive information, or you just feel like you've hopped on this conveyor belt of fertility care, there are other answers out there. There's more out there that your body is trying to tell you, and you just need a medical provider who is able to help put those pieces together for your body. Okay. So to summarize here, the number one mistake that women are making about PCOS that is keeping them from getting pregnant is to not have an individualized fertility plan and to just keep moving forward on this conveyor belt fertility plan that misses out on all these aspects of fertility. Okay. Thank you so much for being here. It is such an honor to be building this community with you. If you are loving this podcast, please head over to Apple Podcasts and give me a positive review, because reviews are what fuel this podcast, okay? And they also help other people who are out there who are struggling with PCOS and fertility to get access to this information, okay? So, if nobody has told you today, you are absolutely amazing, and I am so honored to be here with you. Have an amazing day, and I will see you next week. Thank you so much for being here. It is such an honor to be on this platform with you and to have you in this community. So thank you. As we wrap things up today, I want to share the legal language with you. This podcast is for informational purposes only. It should not replace the medical advice, diagnosis, or treatment given to you by your doctor.